Hi, I'm Dr. Ellen Gendler, a board-certified dermatologist in New York City who's been practicing for more than 30 years, and I am obsessed with retinoids. So this video is going to tell you what I think are the most important things you need to know about retinoids. First of all, what are they? Why the hype? What do retinoids do that makes me think everyone should be using them? What's the right age to start? What about if you're thinking of getting pregnant, or if you are pregnant, what are the different types of retinoids to use? Is it okay if you're flaky and dry from retinoids? And another interesting tidbit about the EU proposed limitation on the percentages of retinol in over-the-counter products. Subscribe. If you like this video, I promise to do more, and hopefully these will be educational about the topics that you're dying to learn about. So how should you think about retinoids, and how should you plan which ones to use? Let me start from the beginning. There are several different types. There's the gold standard, which is prescription strength tretinoin. And that's my goal, is to get patients onto prescription strength tretinoin, because that's where all the really scientific studies have been done. But if you're nervous, if you're young, if you're just starting, if you're very prone to irritation, sure, start with something less potent. I don't recommend starting with anything less potent than retinol, because you're not going to see anything. Something like retinol esters, that's before it. Let's start with retinol. That's the weakest of the retinoids, because it takes 2 steps to convert it to prescription strength tretinoin. A little stronger than retinol is something called retinaldehyde, also known as retinal. And for those of you who tolerate retinol really well, I would move up to retinaldehyde pretty quickly. But still, your goal should be to get to that tretinoin point where you can tolerate it and continue to see benefits to your skin. There's another type of retinoid that's called HPR, hydroxypinacolone, and that is also known as gram-active retinoid. That also is only 1 step away from being converted to tretinoin, but there aren't a lot of really good studies on it, though many people think that HPR is less irritating than most of the retinoids and has the same good effects. I think you can try these things and see how you do. If you get no flaking, no irritation, it's probably not really doing what a retinoid's supposed to do. I always see a little bit of flaking at the beginning of the use of any retinoid. So it's better to use something than nothing. And if you feel that all you can handle is retinol, you can increase the strength of the retinol until you get to the strength that works best for you. Remember, a little bit of flaking at the beginning is perfectly fine. Start every 3rd night, go to every other night when you tolerate, and then get yourself to every night if you want to reap the benefits from retinoids. What's the right age to start a retinoid? In my opinion, the 20s is the perfect time to start a retinoid. Obviously, if you become pregnant in your 20s, you stop the retinoid when you're pregnant. But why do I say this? Number 1, they're very safe. We use them in teenagers for acne. So it's very safe to use a retinoid in your 20s, and I think it's a great idea to get started on a skincare routine that'll help keep your skin healthy and beautiful for your whole life. So start in your 20s. If you are a sensitive skin person, then start low. Start with a retinol or a gram-active retinoid. Just use something that won't irritate your skin too much and that you can build on. And the way I suggest starting is to start, let's say, every 3rd night. Do that until you're not red and irritated at all, then build up to every other, and eventually your goal is to use a retinoid every night. Now, how much do you use? I say you use a little bit on your fingertip, a pea-sized amount. You always hear that, but how do you use this pea-sized amount? Well, you take the little bit of cream, of retinoid cream, and you put it on your fingertip, and then you dot. You take a dot here, 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 and then rub it in, almost as though there's not enough on your finger to cover your whole face. If you put a dot of a pea-sized amount on your forehead and then your cheek and then your nose, you will be so red and irritated you won't be able to use it at all. That's a really important thing. Now, is it bad if you get irritated? It's really not, as long as you're not so irritated that you're uncomfortable. But having a little bit of scaling and peeling with a retinoid is a good sign. Think of it like being sore if you start an exercise routine. It's not always going to be smooth sailing, but as long as you tolerate it, that's fine. You can use a moisturizer on top of it to soothe some of the irritation and some of the dryness, and eventually, I promise, you will be able to tolerate it. Just like when you get into your workout routine, you're ultimately able to do the same thing without having sore muscles every day. Now, what about retinoids in pregnancy? Clearly, oral retinoids like Accutane, isotretinoin, should never be used in pregnancy because of the risk of birth defects. But topical retinoids, the studies on this are very few and far between, and there really is no hard evidence that there is any problem from a topical retinoid. However, the possibility exists of systemic absorption in some people, and that's why, since these are not clearly life-saving drugs in this situation, we tell patients to stop them as soon as they hear that they're pregnant. I personally don't tell my patients to stop in anticipation of getting pregnant, but once they know they're pregnant, I have them stop it. And you can do other things to your skin when you're pregnant to help keep it beautiful, and once the baby is born, then you can resume the use of retinoids. Is dryness and irritation from a retinoid a bad thing? I don't really think so, as long as it doesn't go on for too long. Think of it like high-intensity exercise training. You work out really hard and then you recover. Work out hard and then recover. You can do the same with retinoids. And interestingly, in the original studies on tretinoin, it showed that people who got very irritated at the beginning ended up having that resolved, and they had beautiful results. So I don't mind if you get irritated at the beginning. Don't think of it as a bad thing. Obviously, you shouldn't have red, cracked skin. But if your skin's a little peeling, so be it. I wouldn't try to scrub that off. I wouldn't try to over-exfoliate, because actually tretinoin is a natural type of exfoliant. But you can gently wipe away some of the scales and then try to moisturize your skin with something that seals in whatever moisture is there and makes it less uncomfortable for you. Many of you have asked about a ban in the EU on retinol. There is no ban in the EU on retinol. There might be a change in the way they are recommended. So there's a proposal to limit the strength of retinoid in an over-the-counter body lotion to 0.05% and in facial lotions to 0.3%. That doesn't mean that there have been instances of vitamin A toxicity that have been seen, but it's just for caution. That's what it is. And it hasn't passed yet, though it might. Why is the level lower in the body? Well, obviously because your body is a bigger surface area, and they're concerned that you might be getting too much vitamin A if you apply these products all over your body every day. Ditto for the face. The concentration that they're considering limiting it to is 0.3% retinol, and that's a smaller area, so you wouldn't get as much. Now, I'm not clear, and I don't think anybody else is. What does this mean in terms of over-the-counter? Is it retinol? Is it retinaldehyde? Is it HPR? We really don't know. It's the retinol class. So this remains to be seen, and whether or not it will pass actually remains to be seen. But remember, this doesn't mean that there is a danger in using strengths that are higher than those proposed. Thank you for watching my video. I hope you get started on your retinoid journey today. Please subscribe to my channel. Let me know what other types of videos you'd like to see, and stay tuned for more content.